Hi everybody. So I'm going to be doing a few videos on back pain and how we can start to work to reduce back pain on our own and some just different movement and self-massage techniques you can use to do that. So I'm making a series of these because back pain, even though you might have similar symptoms to other people or similar kinds of pain to other people, the reason you're experiencing back pain could be very, very varied. And it could be coming from different reasons. So I'm going to walk you through some different strategies you can look at, some different movements you can look at to reduce pain and help to bring yourself back to a more healthy, pain-free lifestyle. So the first kind of place that I usually look when I'm working on somebody, either with massage or with movement, is their pelvis and hips. So a lot of times people think they're having lower back pain, and they are. It's not that you're not having lower back pain, but the reason you're having lower back pain might actually be coming from your hips. So one easy way to look at this is just to look at the external rotators of your hip. Now, what does that mean? So I'm going to stand up here. So on the back side of your hips, you have these muscles that rotate the leg out. Okay, so they're called your external rotators. So a really nice thing you can do to see if it is in fact your external rotators that are causing the problem is to use some sort of massage ball to massage the external rotators of the hip. So I really like a tennis ball. I tend to go for something that has a little bit of give. Don't be sort of tempted by harder is better. It's just not the way the body works. You want to facilitate a change. And so you can facilitate a change in the tissue, and then you can also facilitate a change in the way your brain perceives that area, the way your brain moves in that area. And so we'll talk about more of that down the line in other videos. But just to very simply start out, we're going to do a tennis ball. You can do a lacrosse ball, or if you have another specifically massage ball, you can use that. And remember, more is not necessarily better. And so what you're going to do is you're going to take this ball and you're going to pin the ball up against the wall. And what I'm going to be working is I'm going to be working all around what's called the greater trochanter. And that's this bony part of your leg that is more superficial, so it kind of sticks out further. And you have muscles all around that. And then so any place in between the greater trochanter, that's that bony part of your leg that sticks out here, and your sacrum, so that's that triangle bone that's right at the base of your spine, is where we're going to be rolling. And so taking the ball up against the wall, and I'm going to start right above my greater trochanter, and I'm leaning in, and I like coming up against the wall. You can lay on the floor, but I like up against the wall at first just to see, so that I can gauge my pressure, right? If I'm on the floor, I sort of have to use all of my weight, and that might be too much. And especially if you're dealing with pain, remember, we want to have our body be in a safe and comfortable environment, because that's where change happens. When you're under too much pain, or you start so much pain that you're eliciting the fear kind of response in your body and the stress response in your body, you're sort of working against yourself. So I come up against, and I'm right above my greater trochanter, and I'm leaning in, and I'm just kind of rocking back and forth. And I'm really just looking for places where there's just a little bit more tenderness. So when I find a place, I'm just going to hold. So right now I'm on my glute medius muscle, And it doesn't really matter what muscle you're on, right? Your body will be the guide on what's right for you. All right, so I'm just going to, once I found a spot, I'm just going to lean up against that, soften into it, and see if I feel some changing. So right now I'm starting to actually feel the soreness increase. That's not necessarily a bad thing as long as I can still relax through it. It's fine. So as I'm holding here, I'm just waiting for it to change. I'm maybe asking myself, okay, could I relax a little bit more? So that as I relax, the ball goes deeper into the tissue. And so even though I might be working less, I'm getting a deeper response and not being fooled by just a lot of sensation. Whereas I feel like a lot of people, when they're doing self-massage, they're just like trying to get in there and they're moving. You want to relax so that you can go deeper. If you are just digging in there and flipping over stuff, you're not going deep. You're creating a lot of sensation, which may make you think that you're doing a lot, but it's not actually translating over into anything that's creating change. Okay, so it started to lighten up there, so I'm just going to shift so that it's more coming towards my sacrum, towards the back of my spine, and I can come all the way up against the sacrum, right? So there's lots of ligaments there around your sacrum, and so those can become inflamed, and those can cause back pain. They can even cause a sciatic-like symptoms, so sciatica-like symptoms. It's not truly sciatica, it's just these inflamed ligaments and nerves that are mimicking the same symptoms as sciatica, right? So again, I'm just going to find a spot. I'm going to soften into it. And I'm just going to wait and feel what's happening, what's changing, what's shifting, if anything. Okay? And I'm just going to continue on in that way all around. So my greater trochanter's right here. I'm going all around with the ball and even towards the back. So a lot of times your piriformis muscle, which is right about here, can be very tight, which can cause those sciatic issues as well. So what you're going to do is you're going to do that up against the wall on one side, and then pause. Give your brain, body, time to integrate. That's important. A lot of people skip over that step, and I think it's so important, right? So you're going to integrate and give your brain that chance to realize, oh, hey, this has changed. I don't have to go into the same movement patterns. So you're going to do that on one side, pause, notice how you feel, notice the difference from side to side. And then you're going to do the same thing on the other side, okay? So if you're experiencing back pain, please let me know in the comments how that was. Now, if it does nothing, that doesn't mean that like this exercise is pointless. It just means that that wasn't the driver of your back pain. It's not as simple as a one thing fixes all in the body. And if anybody tries to tell you that, just start walking the other way, because there's a lot that goes into making this human body work of ours. So yeah, if you like this, go ahead and give it a like, share it with your friends. And if you're still experiencing pain even after massaging your external rotators of your hip, stay tuned for more of these videos that I'm going to be posting with different movement and self-massage we can do to help diagnose and find what the real cause of your back pain is. So everybody, please stay well and stay tuned for more videos. Thanks.